I want to bring in NBC's Sahil Kapoor, who's been following the hearing. Dr. Kavita Patel was a policy director in the Obama White House and is an MSNBC medical contributor. Former Florida Republican Congressman Carlos Curbelo is an MSNBC political analyst. With me here in studio, independent journalist Philip Bump and emergency medicine physician and former regional director at the Department of Health and Human Services, Dr. Derek Haas. Dr. Patel, Kennedy wrote an op-ed this week. He says his goal is to restore the CDC's focus on infectious disease, invest in innovation, and rebuild trust through integrity and transparency. Is that what you saw today?
No, and in fact, I would say those are great goals. That's actually what Dr. Menarez wanted to do at the CDC before the 29 days that she served was over. So I do think those goals need to then translate into action. And so far, the actions that have been taken actually undermine not only every single one of those goals, but Chris, we've talked about this. Frankly, patients today still cannot get the vaccine, and it's certainly not as easy as he made it sound.
Dr. Cass, toward the end of this hearing, and we sat here together, we heard Roger Marshall, another doctor, and Senator Kennedy talk about empowering parents to make decisions about vaccines. Is guidance from the CDC critical to the decisions they make? Because the suggestion seems to be that this is a somehow corrupt agency.
So again, it's not just guidance from the CDC and its recommendations from the FDA, but it's also how those vaccines are available to parents, how they're available and paid for by insurers. Because even as a parent, if I want my child to be vaccinated, if my insurance won't pay for it or my pediatrician isn't available for a visit and I want to go to the pharmacy, right now in New York City, it's hard for me to do that. So you can empower parents to make decisions to get a vaccine. But what they're doing is they're dismantling the opportunities to actually make that happen on the ground. They're taking down the infrastructure that actually gets those vaccines into the arms of children, even if parents want to get them.
So when you heard him say repeatedly, we're not denying anyone vaccines.
Right. They're not banning vaccines. They're just making it really, really hard to get. They're putting the burden on parents, on individuals. They're taking down the federal responsibility to purchase vaccines in advance, to facilitate insurers for paying for them. And they're making it harder if you're a local pediatrician to serve your patients, because now you're going to get more children coming in for vaccination, more parents asking for notes for their kids, and you're going to have conversations that could have been happening with a pharmacist, but now are going to only be able to happen at the pediatrician's office while taking care of also potentially increasing infectious diseases, other regular childhood illnesses, and visits that kids need to get for, well care.
So, Congressman, it is hard to imagine another hearing with one of President Trump's cabinet secretaries in which some Republicans were this critical. I think that includes probably Pete Hegseth when he was going up against some pretty tough questioning about becoming defense secretary in the middle of the Signalgate controversy. What did you see here?
Well, a lot of frustrations for Republicans. Two main ones, Chris. Number one, Republicans have invested a lot of time and effort to get Trump nominees confirmed in the Senate. It's not easy. It takes up a lot of hours. There's a lot of back and forth, a lot of questions that need to be answered. So the fact that the CDC director was fired just a month after being confirmed by the Senate, that's frustrating. The other big concern here for Republicans is swing voters. This is a public health issue we're talking about. Think about a lot of women who are the health care managers or decision makers in their homes that take care of making sure their kids are healthy. Think about states like Maine, North Carolina, where Republicans are going to have challenges, right? There are going to be Democratic candidates vying to flip those seats. That's another major concern for Republicans here, particularly Senate Majority Leader John Thune. The politics of all of this, it is not good when it comes to swing states and swing districts.
Philip, he mentioned North Carolina. Tom Tillis is retiring, and he was also one of the people who sat there and challenged very strongly what he was hearing and what he knew about Secretary Kennedy, particularly about the firing of the former CDC director. Let's take a listen.
I don't see how you go over 4 weeks from a public health expert with unimpeachable scientific credentials, a longtime champion of MAHA values, caring and compassionate and brilliant microbiologist, and 4 weeks later, fire her because at least the public reports say because she refused to fire people that work for her.
I said this before, they called him on a lot. And again, it wasn't just the Democrats, but does it have any impact on his future? It's one thing for a whole series of Republican senators to say you should step down, right. But could this move the needle?
Well, I mean, it certainly could move the needle. I mean, obviously, the decision maker here is primarily going to be President Trump. President Trump has proven
or
to be
100% going to be.
Right. Well, I mean, Kennedy could decide to, but pretty clearly he's not going to. But Trump has in the past been influenced by public opinion. I think the challenge here is that this entire hearing will be viewed through two different lenses, right? And the lens that I think most people bring to it is clearly Kennedy is in a position that he is not capable of actually fulfilling his duties. That he was pressed by people who were there to hold him to account, and he was not able to
he
back
couldn't
it up.
Answer some basic questions.
Oh, yeah, very essential. And then he made up other statistics and said that his experts were, like Jay Bhattacharya, who's an economist, and Dr. Oz, who's a TV doctor. Like, those are the people he's relying on. But I do think it's worth pointing out, there's some polling came out this week from YouGov that found that overall, about 50% of Americans have at least some confidence in the CDC for medical advice. Only 26% have confidence in RFK. The difference is among Republicans. Republicans have more confidence in RFK. And what they're going to see is someone who's fighting the system and fighting the elites and fighting the Democrats. And in that sense, he was successful, continued to build the political capital that he needs. And that's what Donald Trump's probably going to take away from this.
So, Sahil, when you look at that political reality, Democrats did seem to be chomping at the bit here. They did not bring a butter knife to a sword fight. What was the goal of their aggressive strategy?
Well, Chris, Democrats set the tone early with that joint statement calling on RFK to resign just before the hearing started. So it was really no mystery where they stood on the HHS secretary. They called him a charlatan. They called him reckless and dangerous. They accused him of making misleading and false statements and repeatedly came back to it. They came in knowing that RFK was going to make statements that they could try to disprove with other statements he's made and that he would deny saying things that he has in the past said. They claimed he has empowered conspiracy theorists, crackpots, and grifters to make life and death decisions on public health. Now, RFK repeatedly got feisty with some of the Democrats, talking back to them, interrupting them, accusing them of playing politics, and it led to several fiery exchanges. Take a look.
I hope that you will tell the American people how many preventable child deaths are an acceptable sacrifice for enacting an agenda that I think is fundamentally cruel and defies common sense.
Senator, you've sat in that chair for how long? 20, 25 years, while the chronic disease in our children went up to 76%, and you said nothing.
You're a charlatan. That's what you are. You're the ones who conflate chronic disease with the need for vaccines. Do you believe in doing something about that?
I want to fix the system, and that's what we're doing.
You unilaterally changed the parameters for giving vaccines, making it possible now, to Senator Cassidy's colleagues' points, that they're going to have to go off-label.
This is crazy talk. You're just making stuff up. You're just making stuff up, Senator.
I'm not
You're
making
just
stuff
making stuff up.
You know, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy.
Now, Chris, it's clear that RFK expected to tangle with Democrats. I'm not sure he expected to get quite the level of critiques and pointed questions that he got from Republicans, including, as you mentioned, Senator Thom Tillis, who's not running for re-election, does not have to worry about the politics of this at all, trying to get at the question of whether RFK is creating more chaos and instability after promising to bring stability to HHS and the CDC. The two doctors on the Republican side were the most notable in my estimation of this. John Barrasso, the Senate Majority Whip, a staunch ally of Trump. The fact that he was this pointed about his concerns regarding RFK's tenure at HHS and vaccines was very notable. Bill Cassidy as well, also walking a tightrope, running for re-election. Now, there is an awkward political dynamic surrounding all of this, Chris. Kennedy is, of course, a descendant of the famous Democratic political dynasty. He ran for president as a Democrat just 2 years ago before recognizing he didn't have a path and ultimately joining forces with Trump. There's not a lot of love for RFK, even among the Republicans on the committee. There is a lot of deference to President Trump, however, and that is where a number of, a lot of the support, if not all of the support for RFK is ultimately coming from. Does this hearing change that? I wouldn't discount the possibility, because we're seeing more criticism, as you noted, for this Trump appointee in a senior position than we have for, I think, any others.